about something called the Renin-Angiotensin Mechanism. Have I talked about that before? You guys recall it? Look, she's looking at me like she doesn't know what I'm talking about. Okay. So, this is how your body normally increases blood pressure. Your kidneys release something called renin, right? And renin is a hormone. It's released by the juxtaglomerular apparatus of the kidneys in response to low blood pressure. When your blood pressure drops, your kidneys release renin. Renin starts creating this mechanism where it converts what we call angiotensin 1, which doesn't do anything, into angiotensin 2, and it's facilitated by an enzyme that we call the converting enzyme. So when renin is secreted in response to low blood pressure, angiotensin 1 becomes angiotensin 2. That constricts blood vessels. So that vasoconstricts. Now what happens to your blood pressure when you have vasoconstriction?
Goes up.
It goes up. That's what's supposed to happen. In response to that, your body also, your kidneys, renin, angiotensin, this mechanism activates your adrenal cortex to release a mineralocorticoid known as aldosterone. And what does aldosterone do? Do you guys remember? That's right. It increases sodium reabsorption at the kidneys. And if it reabsorbs sodium, then your body's also reabsorbing water. That's correct. Yeah. So this is how your body increases blood pressure when you have low blood pressure. Now we're going to talk about medications known as angiotensin converting enzyme inhibitors. That means that it blocks this mechanism. So this way, this medication, how it reduces blood pressure is by eliminating this chemical reaction. ACE inhibitors block the converting enzyme, which stop angiotensin from becoming angiotensin 2, which means the blood vessels do not constrict. They relax, blood pressure goes down, and no aldosterone is being released. That means your kidneys are not keeping salt, it's letting it go, hence your fluid is also dropping, and that's how we lower blood pressure. Does that make sense? This medication, aldosterone, influences sodium and potassium. So when this is doing its thing, aldosterone, and it keeps sodium in the body, it excretes potassium. So does that make sense? But since we're giving these medications and we're letting sodium be dumped into the urine because we're not reabsorbing it, well, your sodium goes down, but your potassium goes up. So one of the side effects of ACE inhibitors is hyperkalemia. Does that make sense? Mm-hmm. You have to know that. You're also going to have angioedema. Angioedema is when you have fluid that goes from the vessels into the tissues and mucous membranes around the eyes and things like that. The reason for that is because if you can imagine my hands together, right, they're the wall of the blood vessel. Can you imagine that there's no gaps on the wall right now, right? It's solid. But when you dilate these blood vessels, because that's what's going to happen with when you don't when you block angiotensin converting enzyme, it dilates the blood vessels. So what happens to the walls? They have what?
Start separating.
They start separating, but what do you have in between now? Can't you guys see in between?
Yeah.
So you have these gaps, and the gaps are microscopic, of course, but the fluid now is going to be liable to be escaping through those little channels and through the little gaps, and that's how you develop angioedema. You can develop peripheral edema with people that are taking ACE inhibitors. Does that make sense, guys? Mm-hmm. Okay, that's that one. Hold on for a while.